Hey there, Dr. Katie Thompson. I'm with the Mankato Clinic at the Main Street location in the Family Medicine Department, and I'm here today to talk to you about preventative health care. Now, a lot of people don't really know what that means. Preventative health care means the things that we do to try to take care of you before you get sick. So that means coming in for your yearly annual exams. And what an annual exam might include is talking with your doctor about your health history, any medications or supplements that you take, surgeries you've had, past things you've had in your health, and potentially doing some fasting blood work, a physical exam, and then getting you set up for things like mammograms, colonoscopies, and other screening procedures that might be appropriate based on your health history. The nice thing about annual exams is if you start to do them regularly, your doctor can really get to know you and your specific health needs. And we can then better take care of you as you continue to grow older. The nice thing about family practice doctors is we see people from all age groups, so we really like to see the whole family. We like to see mom and dad and the kids and grandparents and take care of everybody all together. The benefit of having a family doctor and seeing the whole family is that then we get to know you and your specific health problems and health concerns that you may have. And each year we grow that relationship a little bit more and is really successful.
Hello, I'm Dr. Rich Peller, one of the family practice docs at the Mankato Clinic. My office is at Wickersham, and they'd like me to kind of hit on some highlights that I think, especially for men, for needing preventive treatments and evaluations that I think are most appropriate for men in different age groups. You know, most times in the 20s, we can hardly ever get any men to ever come in. So if you ever have any problems, it is good to get a cholesterol or something like that early on in the 20s. Certainly in the 30s, 40s, 50s, and definitely 60s and 70s as we get older. We certainly want to see a little bit more often because our joints start aching a little bit more, and certainly we start having a lot more heart disease and certainly a higher risk of cancers as we get older. The number one killer of all people in America is not COVID. At this point, it is heart disease. Heart disease includes artery disease with heart attacks and strokes, so vascular disease is the number one treatment. There are things we can do to help prevent that, especially if you have family histories. Your parents, brothers, sisters, aunts, and uncles have significant vascular disease or heart attacks or strokes. We want to get you active, exercising, certainly things you can do on your own, as well as weight loss, but certainly sometimes we need cholesterol medications and things like that. And that's why we do start monitoring some of that in the 20s and 30s, and certainly if they're severe, we put people on medications for that. But certainly in the 40s and on, a lot of people can get some help from preventing those types of things. Diabetes is another very common disease that increases your risk for heart attacks and strokes. Those things significantly affect your quality of life. And one of the biggest things that we want to do as primary care physicians is keep your quality of life as good as possible for as long as possible, so you can keep working and doing the things that you enjoy, as well as staying at home as long as possible. One other big thing that we like to watch for is certainly different cancers. Prostate cancer and colon cancer are certainly very common in men. We want to get ahead of things. In my job, my biggest job besides acute problems is making sure we try and prevent further problems. It's like having a leaky roof. If you got a little leak and we get on it early, we can fix it and take care of things fairly easily. If you don't, you get a big problem in the house and it costs a ton more. Same thing with artery disease, weight, diabetes, and
Hi, my name is Dr. Gary Goldberg. I'm a urologist at Mankato Clinic. I've been practicing here close to 20 years, and I'm here today to encourage all men to come to the doctor for their prostate cancer screening. Prostate cancer is the second leading cause of cancer death in men, behind lung cancer, and it is a very preventable cancer just by coming in and having a PSA blood test and a digital rectal examination. We're able to identify the majority of cancers. Most men that are 50 years or older are encouraged to have a PSA blood test along with a digital rectal exam to be screened for prostate cancer. Both very quick examinations, typically need to be done once a year and can potentially save your life. If there is a family history of prostate cancer, we encourage men to come in a little bit earlier, at about 40 years of age, to get a baseline PSA. Obviously, it can elicit a lot of stress coming in and talking about prostate cancer or any type of other urologic issue, including voiding issues that can occur in men in their 50s and 60s and 70s, erectile dysfunction, which can also occur in men in this age group as well. I think it's very important that all men understand that a simple digital examination along with a PSA blood test, both of which are very quick and potentially save your life. So I really encourage you, if you haven't already, to come in, have your digital exam, have the PSA blood test performed. So hopefully, if you do have prostate cancer, we can identify it very quickly, early.
Hello, I'm Matthew Carnes, a gastroenterologist at the Mankato Clinic. I wanted to speak with you today about the importance of screening for colon cancer. Colon cancer is a very common cancer and is one of the most common cancers to affect Americans. The good news is that colon cancer is preventable with early detection and removal of colon polyps. We typically do this through colonoscopy, which is our recommended screening process for colon cancer. I recommend that most adults have a colonoscopy at age 50, but some adults may require earlier colonoscopy if they have a family history of colon cancer or if they're African American. I recommend that you discuss having a colonoscopy with your primary care physician so that you can determine the right age to start screening for you. We can keep people comfortable during colonoscopy by using sedation, and the prep for colonoscopy is not that bad. It's way easier to get a colonoscopy done than have to deal with colon cancer. I recommend that you discuss screening for colon cancer with your primary care physician today.
My name is Julia Omtivid, and I'm an audiologist at the Mankato Clinic. As audiologists, we are trained to assess, diagnose, and treat hearing loss. Farmers and their families are at an increased risk for hearing loss due to noise exposure from working near loud machinery and equipment. A few of the first signs of a hearing loss can include difficulty understanding speech in the presence of noisy environments and tinnitus, which is often described as a ringing or a buzzing in one or both ears. Whether or not you are experiencing these symptoms, we do recommend that you call and schedule a hearing evaluation with one of our audiologists. We can then obtain a baseline hearing test to track changes over time, as well as plan a monitoring schedule to see those changes. Additionally, we can discuss methods of prevention, including the use of earplugs or earmuffs when in those noisy environments. Hearing loss due to noise exposure is irreversible, but there are many things that we can do to help prevent this, and we can discuss this more in depth at your appointment with us. If a hearing loss is diagnosed, there are a variety of treatment options that we can offer, including the use of hearing aids. Here at the Hearing Care Center, we offer a variety of sizes and styles of hearing aids to individually meet your needs and desires for amplification. So give our office a call today to schedule that hearing evaluation. We look forward to meeting you soon.
So as a woman, I think that we oftentimes take care of everyone else but ourselves. And so I want to make sure that the women out there know that it's important to do yearly annual exams. An annual exam for a woman will include a physical exam, oftentimes a breast exam, and potentially a pelvic exam, depending on your specific situation. It's recommended to start yearly mammograms at age 40, potentially sooner if you have any family history of breast cancer. It's recommended to do mammograms yearly to screen for breast cancer. This is something that you'll talk about at your visit with your doctor. Other things that are recommended are pap smears every 3 to 5 years, depending on your specific history. We also do colonoscopies starting at age 50. Sooner again if there's a family history. And then we do fasting blood work, like checking for cholesterol to screen for high cholesterol, which can lead to heart attack and stroke, and also to do a fasting glucose level to screen for diabetes. Diabetes is a common problem that we sometimes run into and can take care of better if we catch it early.
My name is Jenny Madai. I am an RN nurse manager of the Mankato Clinic Breast Center, and I am going to speak today about screening mammograms. The American College of Radiology does recommend starting yearly screening mammograms at age 40. Having a yearly mammogram is important because it allows the radiologist to compare the breast tissue year to year, looking for any changes or new findings for the breast tissue. 3D mammography provides superior imaging as compared to 2D. 3D provides a more detailed look at the breast tissue, especially for women who have dense breast tissue. 3D also allows about the same amount of radiation exposure as 2D and has fewer callbacks than 2D. Most insurance plans do cover 3D, but we encourage each patient to check on their individual coverage prior to the mammogram. Yearly mammography has helped reduce breast cancer deaths by more than 40%. That's because yearly mammograms can detect cancer when it is small and easier to treat. Being female is the biggest risk factor for breast cancer. So please take time to take care of yourself as a woman and talk to your provider about having your mammogram done today.
Hi, I'm Dr. Deer. I'm a pediatrician with the Mankato Clinic, and I just want to remind you why it is still so important to bring your children in for well child checkups. Reason number one, vaccines. At every well child check, we make sure that your children are up to date on their vaccinations. This is especially important right now because globally we have seen vaccine rates fall, which does put us at risk for outbreaks of diseases that we normally don't see. So things like whooping cough, measles, chicken pox, and we really don't want those to make a comeback. And so to help protect you, your kids, and the rest of our community, it is really important to keep your kids up to date on their vaccine. Reason number two, at all well child checks, we make sure that your child is growing and developing well. And if we catch any problems with growth or development early, we tend to be able to correct the problem much quicker and much more easily. And reason number three, at all checkups, we want to make sure that you get your questions answered and offer guidance if you would like that. A lot of parents right now have been asking questions about COVID, what's safe, what isn't, and honestly what to believe on the news and with all the media. So that's been a frequent question that we've been talking about in clinic. And then obviously other questions that you may have, like how much screen time is too much, and should my 14-year-old be staying up till 4 a.m. playing Fortnite? Those types of questions too. So we're happy to provide guidance on that kind of stuff as well. So we hope to see you soon to make sure that your kids are up to date on vaccinations, that they're growing and developing well, and that we get all your questions answered.
We have plenty of opportunity here at the Mankato Clinic to get you in if you need it. I know some people had some questions with COVID. Is it safe to come into the clinic? Is it not safe to come to the clinic? We've set up, certainly like every other place, a lot of safety protocols where people are checking temperatures and asking questions at the front desk. All the staff have temperatures checked. We have a respiratory clinic, so if anyone has any fevers, coughs, colds, congestion, they go up to the respiratory clinic and are seen there and are not in our regular clinics. And so the chance of getting or contracting COVID just because you're coming to one of the other clinics is extremely low. And I want you to feel very comfortable coming into our clinic here, either here at Wickersham, the Main Street, St. Peter, any of our offices to come and see us. And I do strongly encourage you men out there as well as you women to get in and be evaluated for these basic things that we can help prevent.
So we look forward to seeing you here at the Mankato Clinic. We're here for any of your healthcare needs, but specifically we're here for your annual checkups. So don't forget to schedule that and come on in and chat with us and take care of you first. We're here for you.